business, let's talk about 2020 and the future of 2021. I already participated in a couple of phone calls and interviews similar with this subject, and people said to me, "Oh, I was not expecting what you're gonna say, what you've been saying so far in the interviews." So I'll take a little bit different approach this time. I'll take you through my feelings, okay? And I'll tell you 3 feelings I'm feeling right now that are gonna help me to tell you the story of how 2020 went, and now 2021 is gonna be according to me, okay? So the first thing I would like to tell you, and I'm gonna write a couple of things on the chat because I'm Italian, and sometimes when I write down stuff in Italian makes me even more connected to what I'm talking about. So the first thing I feel fortunate. So I feel fortunate. In Italian it would be mi sento fortunato, okay? Fortunato. So this is what I feel right now. Mi sento fortunato, okay? So you can learn a little bit of Italian. What does that mean? Why do you feel fortunate? I feel fortunate because I am a player, because I am active in the life sciences and the healthcare market. And I know I have to respect, and I respect a lot, all the losses, the death that COVID brought. But and it's been a disaster. It's been a real disaster for both my friends and families in Italy and here, and my friends here in the United States. But we have to feel fortunate because we are in the top 3 industry in terms of growth in 2020 throughout COVID. So if you think about COVID, the only 3 or 4 markets that have been growing are e-commerce, obviously, and then there's healthcare, life sciences right there, and then logistics and digital. But we are right there. So I'm not trying to underestimate the impact of COVID for many players in the industry. If you think about medical devices, we're talking with Brian, people that are working in elective procedures in medical devices that have been suffering a lot this year, but probably not suffering as much as other industries out there. So I think that we have to recognize that we are fortunate of being part of this industry. And I think we have to recognize if something happened to us and we lost a job because we were in a company that did not do so well in healthcare, you are in the right spot to jump up again, stand up again, and try again, because healthcare is growing. So around you, you have a growing market. So your skills and expertise and talent that you have been using in healthcare can be deployed in a growing market despite COVID. So that's an important message, because sometimes we don't realize what is happening out there, and we should be fortunate about this. The second feeling, I feel, sorry, I was spelling wrong. I feel positive. Mi sento positivo, like this. So why I feel positive? I feel positive because let's look at 2020. Let's look at some numbers. Let's start from VC. We have Bruce here. We have with James, people that have been working in the VC, in the venture capitalist world for a long time. So I don't know if you know, guys, but this year was the record year of funds raised by US venture capitalists ever, and not by a small amount. In H1, just H1, it was raised, $10 billion were raised by US VCs. 2019 was $10 billion. We expect to close 2020 with beyond 13 billion, even 14 billion dollars of raised funds of US VC involved in healthcare and life sciences. That means 40% more than the best record year ever for the venture capital community. That makes me positive, very positive. Think about that money will go in our business, will go in our business, in our industries, will be invested in biotech, will be invested in DX and digital and in health tech. That's all money that will sustain your company, your dreams, your projects. Then let's go down by one more level, and let's go the level of investments. Let's think about EU and US investments in VC-backed companies. Again, first half of 2020, another record 2 quarters. Never happened so many. Okay, we are so much investments in the industry. You might say, oh, it was inflated by COVID. Not exactly. There was an impact of 5-7% on that, but the rest is really just more interest by external investors or internal investors. External means outsiders that are coming and decided to invest in healthcare. Internal people that already been invested in the business for a long time. And we have outstanding numbers. It looks like biotech, so investments in VC-backed companies in biotech in US and Europe will be 30%, 30 plus, compared to 2019, that again was a record year. These are good numbers, despite the pandemic, despite the macroeconomic crisis we've been going through. So I hope this makes you feel fortunate again, right? Going back to the first comment. So it makes me feel fortunate and positive. I feel empowered. Mi sento, this is a difficult word, ragazzi. Guys, responsabilizzato. Sometimes we make difficult words in Italian, not like the Germans, but mi sento responsabilizzato. Why do I feel empowered? Why you should feel empowered? This is an important message I want to give to you guys. We should feel empowered, and when you feel empowered, obviously, as Spider-Man says, power comes with big responsibilities. We need to understand the responsibilities, but this is a message I would like to give you. The world is watching us. The world is watching life sciences. The world is watching healthcare like it has never done before. COVID brought a lot of attention to us, players in this field. Governments and public institutions are understanding a lot better the importance of our industry. Investors are starting to understand a lot better the attractiveness, the return, the solidity of our industry. Even patients are looking at our industry with a lot of more attention. Before it was just there were receivers of healthcare. Now they want to be much more involved in healthcare because terminology, thanks to media and to what is happening, a lot more terminology connected to technical terminology connected to care, connected to drugs, to clinical trials, to vaccines. It's part of our discussion at our dinner table. It's part of our discussion with our friends. And that makes patients more involved. Sometimes I joke, I said, now everybody, it seems that everybody is the best expert in virology and epidemiology. You go to the coffee and everybody says, I know what's going on. It's not exactly like that, but guys, they are watching us. They are learning from us. They are interested in us. I was thinking about just my kids. Before this year, when I have twin boys and a girl, and they were asking me, Dad, what do you do as a job? And explain to them, yes, I help companies running clinical trials and going through regulatory approvals. I was losing their attention after 2 seconds, probably. Oh, Dad, your job is so boring. Why you're not a fireman? Why you're not a policeman? Now I tell them, you know what I'm doing? I'm helping companies get vaccines out there to prevent COVID or to treat people that are sick because of COVID. Oh man, I'm a little bit more of a superhero to them right now because obviously they've been involved in all this. They've lived through this, so they understand. Even my kids, they understand better the importance of what we're doing. I treasure it. Again, I'm sad that all of this positivity and all this empowerment and feeling responsible comes from desperation and the disaster and the death that came with COVID. So I think we don't want this to happen again, right? We want to prevent it. And that's why we have to feel responsible. All this responsible that all this money is going to come into the system, all this hope that people are putting on